Top 25 Nursing Officer Interview Questions and Answers. A nursing officer plays a vital role in delivering quality patient care, ensuring safety, coordinating with healthcare teams, and maintaining professional nursing standards. During a nursing officer interview, employers assess clinical knowledge, communication skills, decision-making abilities, leadership qualities, and commitment to patient welfare. Preparing well for common interview questions can help candidates demonstrate their competence and confidence. The following 25 nursing officer interview questions and sample answers will help you understand what recruiters expect and provide guidance on how to structure effective responses during 1. Tell us about yourself. I am a qualified nursing professional with strong clinical knowledge and a passion for patient-centered care. My education and practical experience have helped me develop skills in patient assessment, medication administration, emergency response, and teamwork. I enjoy working in fast-paced healthcare environments where I can make a positive impact on patients' lives. I continuously seek opportunities to improve my knowledge and stay updated with modern nursing practices, ensuring high-quality care and professional growth. 2. Why do you want to become a nursing officer? I want to become a nursing officer because it allows me to combine my clinical skills with my commitment to helping others. This role provides opportunities to contribute directly to patient recovery, promote healthcare excellence, and support multidisciplinary teams. I am motivated by the responsibility of caring for patients during vulnerable moments. Becoming a nursing officer will also enable me to advance professionally while making meaningful contributions to healthcare services and improving patient. 3. What are the main responsibilities of a nursing officer? A nursing officer is responsible for assessing patients, administering medications, monitoring health conditions, maintaining accurate records, and collaborating with healthcare professionals. The role also involves educating patients and families, ensuring infection control, responding to emergencies, and promoting patient safety. Nursing officers must follow clinical guidelines and ethical standards while delivering compassionate. 4. How do you handle stressful situations at work? I manage stressful situations by remaining calm, organized, and focused on patient priorities. I assess the situation carefully, follow established protocols, and seek support from colleagues when necessary. Effective time management and communication help me handle multiple responsibilities without compromising patient care. I also maintain a positive mindset and practice self-care outside work to manage stress effectively. Staying composed during challenging situations allows me to make sound decisions and provide safe, efficient care. 5. How would you deal with a difficult patient? I would approach a difficult patient with empathy, patience, and professionalism. First, I would listen carefully to understand their concerns and feelings without interrupting. I would communicate respectfully, explain procedures clearly, and address any misunderstandings. Building trust often helps reduce tension and improve cooperation. If the issue persists, I would involve senior staff or appropriate healthcare professionals. My goal is always to maintain patient dignity while ensuring safe and effective care. 6. What would you do if you made a medication error? If I made a medication error, I would immediately prioritize patient safety by assessing the patient's condition and informing the supervising physician or nurse. I would report the incident according to hospital policy and document it accurately. Transparency is essential in healthcare because it helps prevent further harm and supports learning. Afterward, I would review the circumstances leading to the error and implement measures to prevent similar incidents in the future. 7. How do you prioritize patient care? I prioritize patient care based on the severity of conditions, urgency of needs, and potential risks. Patients with life-threatening issues receive immediate attention. I use clinical judgment, nursing assessments, and establish protocols to determine priorities. Effective communication with healthcare teams also helps ensure timely interventions. By organizing tasks systematically and monitoring patient conditions continuously, I can provide efficient care while ensuring that all patients receive appropriate attention according to their healthcare needs. 8. What is patient-centered care? Patient-centered care focuses on respecting patients' preferences, values, and individual needs while involving them in healthcare decisions. It emphasizes effective communication, empathy, and collaboration between patients and healthcare providers. This approach improves patient satisfaction, trust, and treatment outcomes. As a nursing officer, I believe patient-centered care means treating every individual with dignity, understanding their concerns, and creating care plans that align with their physical, emotional, and cultural needs. He Ephraim Fizza. 9. How do you maintain patient confidentiality? I maintain patient confidentiality by following privacy regulations, hospital policies, and professional ethical standards. Patient information is shared only with authorized healthcare professionals involved in treatment. I avoid discussing patient details in public areas and ensure records are securely stored. Protecting confidentiality builds trust between patients and healthcare providers. I understand that safeguarding sensitive information is a critical responsibility and an essential component of professional nursing practice. 10. Describe your experience working in a team. Throughout my nursing training and clinical practice, I have worked closely with doctors, nurses, technicians, and support staff. Teamwork is essential for delivering quality patient care. I contribute by communicating clearly, respecting colleagues, and supporting shared goals. I value collaboration because it improves patient outcomes and workplace efficiency. When challenges arise, I focus on constructive problem-solving and maintaining positive professional relationships to ensure smooth healthcare operations. 11. What would you do during a medical emergency? During a medical emergency, I would remain calm and follow established emergency protocols. I would quickly assess the patient's condition, call for assistance, and initiate appropriate interventions within my scope of practice. Effective communication with the healthcare team is crucial during emergencies. I would continuously monitor the patient, document actions taken, and assist physicians or senior nurses as required. Prompt action and teamwork are essential for achieving the best possible outcome. 12. Why is infection control important? Infection control is essential because it protects patients, healthcare workers, and visitors from preventable infections. Proper hand hygiene, use of personal protective equipment, sterilization procedures, and adherence to safety guidelines reduce the spread of harmful microorganisms. Effective infection control improves patient outcomes, reduces healthcare costs, and supports a safe clinical environment. As a nursing officer, I strictly follow infection prevention protocols to ensure high standards of patient safety and care quality. 13. How do you handle multiple tasks simultaneously? I handle multiple tasks by prioritizing responsibilities, organizing my workload, and maintaining clear communication with colleagues. I focus on urgent patient needs first while ensuring routine tasks are completed efficiently. Time management and attention to detail help me avoid mistakes. I also remain flexible because healthcare environments can change rapidly. By staying organized and focused, I can manage competing demands while maintaining high standards of patient care and safety. 14. What qualities make a good nursing officer? A good nursing officer should possess compassion, clinical competence, communication skills, integrity, and adaptability. Strong critical thinking abilities help with decision-making in complex situations. Professionalism and accountability are essential for maintaining trust and delivering safe care. Teamwork and leadership skills also contribute to effective healthcare delivery. Most importantly, a nursing officer should remain committed to continuous learning and patient advocacy while providing respectful and evidence-based care to all individuals. 15. How do you educate patients about their treatment? I educate patients by providing clear, simple, and accurate information about their condition, medications, and treatment plans. I encourage questions and ensure patients understand instructions before discharge or procedures. Using language appropriate to the patient's level of understanding helps improve compliance. Patient education empowers individuals to participate actively in their care, make informed decisions, and manage their health more effectively, ultimately leading to better healthcare outcomes. 16. What is the importance of documentation in nursing? Documentation is essential because it provides an accurate record of patient assessments, treatments, and progress. It supports communication among healthcare professionals, ensures continuity of care, and serves as a legal record. Accurate documentation helps prevent errors and improves patient safety. As a nursing officer, I understand the importance of recording information promptly and correctly to support quality care, accountability, and compliance with healthcare regulations and standards. 17. How would you handle a conflict with a colleague? If a conflict arose with a colleague, I would address the issue professionally and respectfully. I would seek a private discussion to understand their perspective and communicate my concerns calmly. My focus would be on finding a solution rather than assigning blame. Maintaining positive working relationships is important for teamwork and patient care. If necessary, I would involve a supervisor to facilitate resolution while preserving a professional and collaborative environment. 18. What are your strengths as a nurse? My strengths include strong communication skills, attention to detail, empathy, and the ability to remain calm under pressure. I am dedicated to providing patient-centered care and maintaining professional standards. I work effectively within multidisciplinary teams and adapt quickly to changing situations. My commitment to continuous learning helps me stay updated with current healthcare practices. These qualities enable me to contribute positively to patient care and organizational goals. 19. How do you stay updated with nursing practices? I stay updated by attending training programs, participating in workshops, reading professional journals, and reviewing clinical guidelines. Continuing education is important because healthcare practices evolve constantly. I also learn from experienced colleagues and participate in discussions about patient care. Staying informed about evidence-based practices helps me provide safe and effective care. Continuous professional development ensures I maintain competence and contribute positively to healthcare quality and patient outcomes. 20. What would you do if a patient refused treatment? If a patient refused treatment, I would first seek to understand their concerns and reasons for refusal. I would provide clear information about the benefits, risks, and alternatives while respecting their autonomy. Effective communication often helps address misunderstandings or fears. If the patient still refused, I would document the decision and inform the healthcare team. Respecting patient rights while ensuring informed decision-making is an important nursing responsibility. 21. Why is communication important in nursing? Communication is vital in nursing because it promotes patient safety, trust, and effective teamwork. Clear communication ensures accurate information exchange regarding patient conditions, treatments, and care plans. It helps prevent misunderstandings and medical errors. Good communication also improves patient satisfaction by making individuals feel heard and respected. As a nursing officer, strong communication skills enable me to collaborate effectively with colleagues and provide high-quality, patient-centered care. 22. How do you assess a patient's condition? I assess a patient's condition by collecting relevant health information, observing symptoms, measuring vital signs, and performing physical assessments. I also review medical history and communicate with the patient to understand concerns. Accurate assessment helps identify health problems and determine appropriate interventions. Continuous monitoring allows me to detect changes promptly and respond effectively. Thorough assessments are fundamental to safe nursing practice and successful patient outcomes. 23. Describe a time you demonstrated leadership. During clinical training, I often coordinated tasks among team members during busy shifts. I ensured effective communication, delegated responsibilities appropriately, and assisted colleagues when needed. By staying organized and focused, I helped maintain smooth workflow and quality patient care. Leadership in nursing involves supporting others, making informed decisions, and setting a positive example. These experiences strengthen my confidence and ability to contribute effectively in healthcare environments. 24. What motivates you as a nurse? My greatest motivation is the opportunity to make a positive difference in patients' lives. Helping individuals recover, providing comfort during difficult times, and supporting families gives me a strong sense of purpose. I am also motivated by continuous learning and professional growth within healthcare. Knowing that my work contributes to patient well-being and improved health outcomes inspires me to perform my duties with dedication, compassion, and professionalism. 25. Why should we hire you as a nursing officer? You should hire me because I possess the clinical knowledge, communication skills, and dedication required for the nursing officer role. I am committed to delivering safe, compassionate, and patient-centered care while maintaining professional standards. I work well under pressure, collaborate effectively with healthcare teams, and continuously seek opportunities for improvement. My strong work ethic, adaptability, and passion for nursing will allow me to contribute positively to your healthcare organization. Preparing for a nursing officer interview requires a strong understanding of nursing responsibilities, patient care principles, communication skills, and professional ethics. Employers seek candidates who can demonstrate clinical competence, compassion, teamwork, and leadership potential. Reviewing these common interview questions and practicing well-structured answers can significantly improve your confidence and performance. Focus on providing clear examples from your experience whenever possible. With proper preparation, professionalism, and a patient-centered mindset, you can successfully secure a nursing officer position and advance your nursing career.